Hey everyone and welcome. Today we are diving into what is arguably one of the most critical skills you'll ever use in nursing, documentation. And look, it's so much more than just paperwork. It is the absolute bedrock of patient safety and, honestly, your own legal protection. So let's get right into what makes for great charting versus what could become a real disaster.
So let me ask you this right off the bat. Is your charting a safety net or is it a legal liability? Think about it. Every single note you write either builds this wall of protection around you and your patient, or it creates a massive risk. Throughout this explainer, I'm going to show you exactly how to make sure it's always the first one.
First things first, we have to tackle the why. It's so easy to see charting as this tedious chore that just pulls you away from your actual patients. But once you really get its core purpose, it completely transforms from a chore into one of the most powerful tools you have for providing truly excellent care.
I want you to think of your documentation as the central nervous system of patient care. Seriously. It's the official legal record, right? It's the primary line of communication for the entire healthcare team. Doctors, therapists, other nurses. It's what guarantees continuity of care when you hand off to the next shift. And beyond all that, it's the hard evidence that can protect you in court, and it's the data that drives quality improvement and, even secures reimbursement. You see, everything flows right through it.
Okay, so we've got the why down. Now let's really get into the how. These next 7 things, they are the core standards for what I like to call bulletproof charting. These are totally non-negotiable principles that are going to protect you, your license, and of course, most importantly, your patients.
All right, let's break these down. First, be accurate. This is all about facts. Chart what you see, what you measure, what you do, not what you think is happening. Next, be complete. You've got to tell the whole story. Leave no gaps that could lead to dangerous assumptions. Number 3, be timely. This one is so crucial. Charting in real time is the gold standard because let's be real, your memory fades and it fades fast. Then uphold confidentiality. That's your HIPAA duty, plain and simple. Always be objective. Stick to the facts, not your personal feelings or judgments. Make sure it's legible. I mean, what's the point if no one can read it? And finally, authorize properly. Every single entry needs your signature, the date, and your credentials. It's your professional stamp of approval.
Okay, so with those core standards in our back pocket, let's move this out of the textbook and into the real world. Different situations are going to call for different charting techniques, and picking the right format can make your documentation way more efficient and a whole lot more effective.
So here are 4 of the big ones you're going to see all the time. You've got narrative charting, which is kind of the classic storytelling approach. Then there's SOAP notes, a really structured way to handle a specific problem. Pie notes are fantastic for tracking progress on an issue over time. And focus charting. That lets you really zero in on a particular patient concern or a significant event. The real key here is knowing which tool to pull out of your toolbox for the job at hand.
Now this is a perfect example of a super powerful technique. Quoting the patient directly. I mean, you could write, patient reports chest pain. Sure, that's factual, but it's so generic. Quoting the patient saying, I feel like an elephant is sitting on my chest, wow, that is vivid, it's specific, and legally, it's ironclad. It totally removes your interpretation and just lets the patient's own words tell the critical story.
Okay, this slide right here, this is where the rubber meets the road. On one side, you have charting that is just messy, it's vague, it's subjective, it's a total legal and clinical minefield. And on the other side, you have charting that is clear, precise, and objective. Our goal is to always produce documentation that looks like the one on the right. It's defensible, it's professional, and it's a crystal clear record of competent care.
Now, let's flip the coin for a second. Knowing all the best practices is really only half the battle. It's just as crucial, maybe even more so, to know the common pitfalls that can completely tank your documentation. So let's look at the errors that you have to avoid at all costs.
These 5 errors, I'm serious, they can be career enders. First, pre-charting. Never, ever document something before you've actually done it. It's fraudulent and incredibly unsafe. Second, using vague terms. Words like good or normal or ate well, they're meaningless without specifics. Third, omissions. Leaving out critical info, like a patient's refusal of care, can be just as damaging as writing something wrong. Fourth, writing subjective opinions. Just stick to the facts and stay away from personal judgments. And finally, failing to document refusals. Look, if a patient refuses a treatment and you don't chart it, legally it looks like you never even offered it. That's a huge problem. So as we wrap up, I really want you to reframe how you see documentation. It is not just some task you have to check off a list. It is your professional signature. Every single entry you make is a permanent testament to your critical thinking, your diligence, and the quality of care you provide.
Really, it all boils down to the simple, powerful idea. Clear notes lead to a safe patient. A safe patient leads to a protected practice. The three are absolutely 100% inseparable. You can't have one without the others.
So, I'm going to leave you with this question to think about. Years from now, if somebody, a lawyer, another nurse, anyone, pulls up one of your patient charts, what story is it going to tell about you? Your documentation is your professional legacy, and you're writing it one entry at a time. Make sure it's a story of excellence, safety, and unwavering professionalism.